Good morning. This is Dr. Mirrafati from Mira Aesthetics. Today we have one of our lovely patients, which we did her revision of her breast. She had an old implant there for how many years?
17.
17 years.
Yeah.
Now, those are the Dow Corning implant that I always talk about. Those implants, in reality, if you go on FDA site, it says all implants need to be changed every 10 years. They recommend it. But the newer implant, you don't need to really do that. I always tell patients. But I think the older implant, that was a good call because I even said it afterward. The Dow Corning implant, the shell gets really thin and what we have the seeping of the silicone implant. So it's a good idea if you have the old implant, change it. The newer one, you don't change it. Especially you have the newer one, so you don't change it. If it's not broken, don't touch it. 17, 20, 25, let it go. But if you read the recommendation of FDA says every 10 years, but in reality, that's just for us to make more money. So don't change it. If you have no problem, don't change it. So how was your experience with us?
It was actually really great. I did my research. I went to 3 different doctors. I felt very comfortable with you and you were very honest with me. You even said, hey, if you don't go with me, that's fine, but this is what I recommend. So I really liked that. You weren't trying to just get my business. And everybody was really nice. You made me feel very comfortable. Even Dr. Payne was amazing, who's the anesthesiologist. And I've had a great experience. You know, the first day, you kind of feel uncomfortable, but every day I've felt better. I really like the results so far. I'm about 2 weeks post-op about.
Post-op, right?
And I feel better every day. So I've had a great experience. Yeah.
Good. Well, she already told me she referred a patient to us, but I don't need to ask her, how do you rate us? Would you refer a friend? But she already did.
Yes, I did.
So
my friend's excited. So she'll be, I think it's in March, she'll be having her procedure done. So she's looking forward to it.
Beautiful. Hopefully we can do as good as we did for you and get her recommendation as well. Yeah. There you go. Well, thank you very much for your testimonial. I won't take too much of your time now. Thank you.